The first paper is titled Quality of Life After Laparoscopic Limited Gastrectomy Using Sentinel Node Navigation Technique in Gastric Cancer, Single Arm and Single Center Phase 2 Clinical Trial. It's going to be presented by Dr. Kim and his colleagues from the University Bundang Hospital, Seoul National University, from Seoul, Korea. This is your forward of your button, and we have a laser pointer here for you.
Thank you. Thank you, Mr. Chairman. Good morning, ladies and gentlemen. I'm very honored to be here and to present my lesson work, the quality of life after laparoscopic limited gastrectomy using Sentinel node navigation surgery. I have no COI for this talk. As you know, the Sentinel node navigation surgery is a very well established procedure in breast cancer and melanoma, but we have not much data for gastric cancer surgery, although the potential benefit of Sentinel node navigation surgery in gastric cancer also is great. During July 2010 and April 2013, we enrolled 112 patients, but the target sample size was 100 patients. Inclusion criteria was age between 20 and 80. And the indication was clinical T1 N0 M0 and clinical T2 N0 M0, less than 4 centimeter tumor size, and without other malignancy. We used two tracers. One is isotope, which was bind with antimony sulfur colloid, and also we use vital dye ICZ. We inject those two dyes into submucosal layer intraoperatively. We checked each sentinel node status by 2 millimeters sliced frozen section biopsy using by HE stain and lipid immunohistochemistry staining. You can see here 11 patients had sentinel node positive, and those patients had conventional laparoscopic D2 or D1 plus lymphadenectomy. And node negative patients, they had limited gastrectomy, which include intraoperative ESD and wedge resection. Sometimes we did a partial or segmental gastrectomy. For assessment of quality of life and remnant gastric function and nutritional status, we use URTC QLQ C30 and STO22 in Korean version. And also we checked gastric emptying scan, and also we checked body weight and BMI and abdominal outer circumference and abdominal fat area and abdominal subcutaneous area. And also we did biochemical parameters check, which include hemoglobin and lymphocyte count and serum protein, albumin, and cholesterol and transferrin. This slide shows the result. Sentinel lymph node navigation surgery group had, I can see it, I cannot see it too small. Global health status and the physical. Can I use my left side? I cannot read. The letter is too small. I cannot read. You cannot read it from there. Okay. Yeah. Thank you.
Well, I think you'll have to stand the microphone.
Speak very loudly.
Yeah, speak loudly.
Sentinel group patient shows better quality of life in terms of global health status and physical function and
Dr. Kim, do you have your slides?
Thank you. TLC and cholesterol and total protein and total albumin, except transferrin. So, conclusively, we strongly believe sentinel node navigation surgery shows better quality of life than laparoscopic distal gastrectomy patient in stage 1 gastric cancer in terms of global health status and physical function, emotional, cognitive, social function, and less fatigue, less insomnia, less diarrhea, and less dysphagia. And also, sentinel node navigation surgery group shows better nutritional outcome. Thank you very much.
Thank you very much. This paper is now open for discussion. You can come to the microphone. Maybe I'll start by asking Dr. Kim, you've selected a group of patients who have T1 or T2 gastric cancer. What imaging studies or what type of studies do you use to determine that the patient actually has a T1 or T2 cancer?
In our career, we have a lot of early gastric cancer patients because so we had a screening system supported by national government. So every patient checked by endoscopic ultrasonography and preoperative CT scan, or we decide those patients T1 and T2 tumor by EUS and CT.
Thank you. Additional questions regarding this interesting sentinel node paper? Other questions? Dr. Loya.
Can you tell us again, when did you measure the quality of life post-op?
Post-op, we checked QOL and other parameters 3 months and 6 months and 1 year after operation.
So even at a year, these patients had significant issues with quality of life if they were in the traditional group.
Yeah, practically it's not a big difference, but statistically, the sentinel node navigation surgery patients shows better quality of life in each items.
Did it seem to come back together at 1 year, or the differences stayed at 1 year?
Yes.
Which one?
So as you can see it, my slides. Could you show my slide back?
It's about halfway through.
Go back. 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 Yes, as you can see here, the dysphagia and anxiety, less anxiety and less eating restriction, and the better in global health status and physical function and emotional function and cognitive function and social function, and less fatigue and less insomnia and less diarrhea.
Other questions? Thank you very much, Dr. Kim.
Thank you.